Do you think depression is increasing, or do you think it's decreasing? I'm Asaki Matsuzaki, a psychiatrist. Today, let's talk about the prevalence of depression. To start with the conclusion, recent studies suggest that depression has been increasing. There are mainly three reasons that have been proposed for the increase in depression. First, changes in marital stability and family structure, changes in health insurance status, and changes in the composition of the labor force. In other words, socioeconomic changes may be associated with an increase in depression. Second, substance use disorder has been increasing worldwide. It has also been pointed out that this may be one factor behind the increase in depression. In particular, substance use disorder is thought to be contributing to higher rates of depression among young black men. This factor seems to be less prominent in Japan. And third, in an effort to improve people's mental health, depression has been frequently covered in the media. In addition, promotion by pharmaceutical companies that handle antidepressant medications is also thought to have had an influence. As the stigma surrounding depression has decreased, more people have come to know more about depression. And as a result, it is possible that more people with depression have become aware of their condition and sought medical care. At this point, what concerns me as a Japanese psychiatrist is depression among Japanese people. The proportion of Japanese people who experience depression at some point in their lives is said to be about 6%. The 12-month prevalence, that is, the proportion of people who experience depression within a one-year period, is said to be about 2% among Japanese people. In fact, the prevalence of depression in Japan is lower than in Europe and the United States. For example, according to the 12-month prevalence of depression in the DSM-5-TR, the rate in the United States is said to be 7%. In Japan, however, it is only 2%.
7%, 2%. Japan is lower.
If depression is indeed less common among Japanese people, that would be good news for us as Japanese.
After all, we frequently eat fermented foods, such as natto and miso. We also eat a lot of fish. Japanese food may have a positive effect on mental health. For example, there are also reports suggesting that unique aspects of Japanese culture may be contributing to lower rates of depression.
However, it has been pointed out that there may be many cases of hidden depression in Japan. There are two main reasons for this. People with depression in Japan are said to complain more often of physical symptoms such as abdominal discomfort, headaches, and neck pain rather than mood-related symptoms.
Japanese people often suppress emotional expression.
As a result, psychological distress may be more likely to manifest as physical problems. Because of this, people who essentially have depression may not meet the diagnostic criteria for depression, and their condition may go unrecognized. In addition, it has also been pointed out that many people with depression are more likely to visit general internists rather than psychiatrists, and as a result, depression may sometimes be overlooked. And second, compared with Western countries, Japanese people may be less likely to seek medical care even when they develop depression. Japanese people tend to have a strong sense of shame, and there may be strong cultural stigma toward depression rooted in a shame-based culture. Now then, we've talked about many things related to Japan. We've also talked about many aspects of depression. First, depression has been gradually increasing. In Japan, the lifetime prevalence is about 6%, and the 12-month prevalence is about 2%. Compared with Europe and the United States, the rates in Japan are lower. Simply hearing this discussion does not mean that the treatment of depression will suddenly become successful. However, I hope it has helped deepen your understanding of depression, even if only a little. What did you think after listening to this? If you'd like, please feel free to leave a comment. That's all.